Hello, my name is Jeff Petersen of Petersen Physical Therapy. I want to talk to you about today about how to use the different attachments on a percussion massage gun. We've done a comparison in previous videos of this particular gun. This is my favorite. You can go back and watch those, and we're going to do more of those. But for right now, I want to talk about how you use these. If this is helpful to you, please like, subscribe to our YouTube channel, send us comments, and share it with your friends. So massage guns have become really popular. I've talked about earlier, and I just will reiterate that these percussion guns, they translate back and forth as opposed to the old-time vibrating massagers, which would go side to side. We still use the vibrating massager side to side in physical therapy if we want to facilitate a muscle and wake it up for certain conditions. With these, it's designed to increase circulation, aid in recovery, and also inhibit pain. And that happens because it's a pretty high intense stimulation to the tissue, so that relaxes the nervous system. It also creates a certain amount of deformation of the tissue that it's percussing, which will increase the circulation. So how do you do it, and where do you do it with the percussion gun? As you can see, there's all sorts of different attachments here. So we got this is probably the most common one. Now these balls and the attachments come out just by gently pulling and twisting. So you've got the kind of the foam ball, and these are all equivalent to almost like when you roll on a foam roller to relax your IT band or your hamstrings. You've got, and this one is good for large muscle groups. You've got, this one's called the bullet, and these are for trigger points. This is for stimulating trigger points on each side of the spine. And then you've got the soft, the air-filled ball, and this is one that I've started using more often. I want to start, though, by mentioning some precautions. You don't want to do the percussion over bony areas. You certainly don't want to do them over pulses, so you can get a radial pulse here. You know, you don't want to do it over the neck or in front on the pulse here. The back of the neck, you need to be careful. The upper traps, we'll talk a little bit about that. And you really want to be careful around tendons. You can do tendons, and I'm going to talk about that in a little bit. So the first one, this is the most popular one. It's the round ball. You want to use it over large muscle mass areas. And the quads, you can do that, and it feels really good. Now, one of the things I want you to notice, if I come down, you don't want to get on the patella. If I get on the patella, you can kind of hear it kind of bouncing, and it's uncomfortable. So you want to stick to the muscle mass area here or here in the lateralis. You can do the glutes. Now, I personally find it kind of difficult to get to the back. If you don't have any shoulder pain, you can use this on your back, or you can have someone, a spouse or a friend or a partner do it to your back. So this one is for the large areas. Now, one of the areas that I like to do it on, because I'm going to take my shoes off, and I think I changed my socks this week, so we're good, is at the end of the day, if my feet are tired, I will use a couple different balls. One ball you can use, or one attachment, is the foam ball, and I'll use the foam ball as it falls out on my calf muscles. There are two heads to your calf, and I'll use the large one on the muscle mass here. And you can actually come down to what's called the musculotendinous junction down here. So it's some muscle, some tendon. And that's really helpful, and it can relax your legs and increase your circulation. As you get lower in the foot, you need to be careful, because especially on the inside, there are some tendons and nerves in there. And that doesn't mean I don't do that area, because I've had some plantar fasciitis, but that's when I get over those tendons, I'm going to use the air-filled ball, because it's a lot more comfortable, and it can really be relaxing. And I'll show you that one. So I'll use that down over the tendon and into the smaller muscles. There are still muscles down here that aren't part of your calf, right in here. Now you need to be careful because sometimes you stimulate that nerve and it can be a little bit uncomfortable. So you just want to be careful there. The other area that I like to do it is in the sole of my foot. And what I'll do with this is I'll start, when I'm really painful, you see how it's bouncing because it gets really tight? I'll start with, towards the heel, gentle pressure using the air-filled ball, and then I'll progress to the bullet. Now that can be really uncomfortable, but it can really help with relaxing those feet and increasing the circulation. You don't want to do on the top, on the tendons there. It can create some challenges. The other area that I like to do, and if you pan up here I'll show you, with the air-filled ball is the muscles of the hand. So the nice thing about the hand, what I'll do is actually reverse it, is I'll rest my hand on there and just get those muscles of the thumb, you know, after working as a therapist all day, the muscles on the outside of the hand, and then I'll work my way up, not necessarily, again, not over the pulses or the median nerve here, but I'll work my way up to the forearm muscles here. And that can really be relaxing. It's not uncommon, you know, golfer's elbow. Jeremy, who's our videographer, was talking about developing a little tendonitis from doing some pull-ups. So you can do the flexor surface here, and then you can do the extensor surface. When you do the extensor surface, be careful because there's a nerve that comes right here behind your elbow, and there's also your radial head. So you want to avoid the outside here, but you can get this big flexor mass. And for that, I would use the air-filled ball. Now, the flat head is really helpful for the IT band. Many of you will roll out your IT band on a foam roller. This is really good for the IT band. So when you use that, last shot of the legs, Jeremy, they're going away. So if you want to kind of release that IT band. Now keep in mind, some people will do IT band or iliotibial band stretches because it basically runs from your ilium. There's a muscle in here, the tension fascia lata, and then it runs down to the tibia. But it's a tough, thick connective tissue, and it's really hard to stretch. But you can inhibit the tissue under it by using the flat head and doing a percussion massage. So that's nice. That's equivalent to kind of doing the foam roller. Now, the bullet and the fork bullet are designed for trigger points. And this is a little bit more challenging, and they do make, and we haven't seen it yet, but we may review that in the next one. They do make a massage tool that has a handle so that you can get your back and your neck. But you can use this for trigger points. Now sometimes people will get trigger points in their lats. The lats, if you're working here, I would start with the soft ball, and then you can progress to the foam ball. You want to make sure you don't get in the armpit. Same thing with the chest, if you have a trigger point in the chest or in the upper trap. So what I'll often do is you find the pec and you find just a real tender spot, and you can work that pec, being careful not to stay on the ribs. You want to go between the ribs. And you can work there. The other area that you can work is the shoulder, and that's where this one really works well. If you've had some shoulder issues, I don't know why I keep turning it off, but we'll see. If you rest your shoulder, and you can work your anterior, your middle, and your posterior deltoid. This is a really good one to get that shoulder relaxed. You can do your biceps tendon and your biceps with the large ball. And it really does a great job kind of relaxing those muscles and increasing the circulation. Treatment times are usually 6 to 8 to 10 minutes. These have built-in timers, so they will shut off. The recovery fun timer is 10 minutes, and then you can work on another area. So for the trigger points, this one is designed, and I'll be honest with you, I don't use this one in the clinic because it's a little bit uncomfortable, but it's designed to work along the spine, so you get the trigger points. You put the process, do the percussion. I find it a little bit uncomfortable. So what I'll normally do is either use the foam ball, or the air-filled ball, or the foam ball for the spinal muscles. And now you need to be careful if you're frail, if you're a little bit older, if you're thin, you can really irritate areas in the spine, in the elbow, on the shoulder. You want to stay off those bones, and if it starts bouncing around, or that you hear the frequency change, or anytime it's really uncomfortable, you want to stop. The one thing with discomfort is when you use the percussion tool, even on the big soft tissue areas. So one of the areas that I'll work is my glutes and piriformis. When I work this area here, it's uncomfortable, but it's uncomfortable in the muscle. If I were to come out here to my tuberosity, you can hear the frequency change, and that would be irritating and uncomfortable. So you want to make sure it's comfortable and you're on the soft tissue, and you can feel that kind of ache like you're getting a massage. This is like massage guns, and you can really feel it start to relax, and the ache will go away. If it's on the bone, it's going to continue to get irritated, and it will not be comfortable. So those are the different heads and how we use them. In our earlier review, I like this recovery fun gun because it is a little bit heavier. So when you're working on a partner or on a patient, the weight of it, you don't have to push so hard. The amount of, when you do push, or if you push to really get in an area, the motor, this brushless motor, 100 watt motor, is enough that it doesn't stop. Whereas some of them, it'll actually, you'll overcome the motor and it will start to stop, and that will create some wear and tear on it. And it really is a nice way to recover. So I hope that was helpful. If it was, like I said, please like us, subscribe to our YouTube channel, and share it with your friends. We appreciate your time.